One drop of her blood poisoned an entire EA. The date is February 19th, 1994. Inside trauma. Room 1 at Riverside General Hospital in California. It's controlled chaos as a medical team fights to save a dying woman. It's a scene that plays out in emergency rooms every day, but this night was going to be different. This night, the patient on the gurney would become a source of sheer, unexplainable terror. As a nurse draws a vial of blood, she physically recoils. A harsh chemical smell, like ammonia, stings her nose. Inside the syringe, strange, manila-colored particles are floating in the dark red fluid. A few moments later, that nurse, Susan Kane, collapses. Then, a medical resident, Julie Gurchinsky, feels lightheaded and falls. A third staff member, respiratory therapist Maureen Welch, passes out cold. Within minutes, the A descends into a nightmare. Doctors and nurses, professionals trained for the absolute worst, are being struck down by an invisible force. Some convulsing on the floor, others unable to breathe.
I can't breathe.
Ultimately,
Something's wrong with
23 of the 37 staff
Help her.
members in the emergency room that night would get sick. 5 of them had to be hospitalized. The source of the terrifying contagion seemed to be the very person they were trying to save, a 31-year-old woman named Gloria Ramirez. She would be pronounced dead less than an hour after arriving, but she left behind a question that has baffled scientists for decades. How could a dying woman seemingly turn into a human chemical weapon? This is the story of how one drop of her blood appeared to poison an entire EA, and why it remains one of medicine's most frightening unsolved mysteries. Section 1. A mother's final hours before she became a medical enigma. Gloria Ramirez was a daughter, a wife, and a devoted mother of 2. Living a normal life in Riverside, California, she was, by all accounts, just like anyone else. But at only 31, she was fighting an extraordinary battle with late-stage cervical cancer. It was aggressive, and it was terminal. By February 1994, she was at home in palliative care, surrounded by her loving family who was watching her fade away. On the evening of February 19th, her health took a terrifying nosedive. She started having heart palpitations, and her breathing became dangerously erratic, a pattern known as Cheyne-Stokes respiration, which is often a sign that death is near. Her family, desperate, called 911. Paramedics found Gloria confused and barely conscious, with a dangerously high heart rate and plummeting blood pressure. They gave her oxygen and raced her to the nearest hospital, Riverside General. For the E-team on duty, the call was tragically routine. A terminal cancer patient in cardiac distress was a familiar, heartbreaking scenario. They had no reason to believe this case would be any different. No one could have predicted that in less than an hour, their world would be turned upside down, and Gloria Ramirez's name would become infamous, forever linked to the title the media gave her, the Toxic Lady. Section 2. Chaos in the trauma room at 8:15 p.m. Paramedics wheeled Gloria Ramirez into the emergency room, and she was immediately taken to Trauma Room 1. The team sprang into action, giving her a standard cocktail of drugs like Valium and lidocaine to try and stabilize her. But Gloria wasn't responding. Her condition just kept getting worse. That's when the first strange signs started to appear. Several staff members noticed an unusual oily sheen on Gloria's skin. Some also caught a faint, fruity, garlic-like odor coming from her mouth. These were odd details, but in the heat of an emergency, they were just fleeting thoughts. The team had one focus, saving her life. As her heart started to fail, they prepped the defibrillator, tearing open her shirt to apply the paddles.
Clear.
And that's when things went from strange to
1
terrifying.
milligram epi is
A registered nurse, Susan Kane, was tasked with drawing blood. As the syringe filled, an overwhelming chemical odor, which she later said smelled like ammonia, erupted from the vial. She passed the syringe to Julie Gurchinsky, a medical resident, who not only confirmed the foul smell, But notice something that defied all medical explanation. Floating in the blood were small, manila-colored particles, like tiny crystals. Before anyone could even process what they were seeing, Susan Payne, the nurse who drew the blood, collapsed. Julie Gurchinsky, who was holding the syringe, suddenly felt dizzy and then fainted. A few feet away, respiratory therapist Maureen Welts also lost consciousness. Panic ripped through the A. Staff members who had been close to Gloria's gurney started reporting horrifying symptoms. Some felt nauseous and began vomiting. Others had shortness of breath, uncontrollable muscle spasms, and even temporary paralysis. The supervising doctor, seeing his staff dropping one by one, made a decision you almost never hear. He ordered a complete evacuation of the emergency department. All patients were herded out into the hospital parking lot as the EAs placed under quarantine. A skeleton crew, some now in full hazmat suits, stayed behind, desperately trying to save Gloria. But it was too late. Amid the chaos, as her own body was seemingly taking down the very people trying to help her, Gloria Ramirez's heart gave out. At 8:50 p.m., just 35 minutes after her arrival, she was pronounced dead. Her death, however, wasn't the end of the incident. It was the beginning of the mystery. With the AEN locked down, a hazmat team combed the room, searching for the source of the toxin. They found nothing. In the aftermath, 23 hospital workers had been affected. 5 were hospitalized. Julie Gurchinsky, the resident who held the syringe, was hit the hardest. She spent 2 weeks in the ICU, suffering from pancreatitis, hepatitis, and a vascular necrosis, a condition where bone tissue starts to die. She would need crutches for months. Whatever happened in that room wasn't just a strange smell. It was a potent, debilitating poison, and all signs pointed to it coming from the body of Gloria Ramirez. Section 3. The investigation and competing theories in the weeks and months that followed. Investigators descended on Riverside General Hospital to answer an unprecedented question. How did a human being become toxic? The media went into a frenzy, with headlines about the toxic lady spreading nationwide. Gloria's family was left in agony, unable to bury her as her body was sealed in an airtight aluminum casket, now considered hazardous material. The pressure to find an answer was immense, and 2 starkly different theories emerged. The first official explanation from county health officials was mass hysteria, or what's now called mass sociogenic illness. The theory proposed that the symptoms weren't caused by a physical poison, but by a psychological event. The idea was that the foul odor from the blood acted as a trigger, creating a moment of extreme fear in a high-stress environment. When the first nurse fainted, it kicked off a domino effect of panic, causing others to experience very real physical symptoms. Proponents of this theory pointed out that a full hazmat search of the ER found no toxic chemicals. Also, the symptoms varied widely, and not everyone near Gloria got sick, which can be a hallmark of a sociogenic event. The initial report from the Department of Health concluded this was the most likely cause. However, the medical staff who lived through it angrily rejected this explanation. Julie Gurchinsky, who suffered severe, long-term health issues including the avascular necrosis in her knees, was especially vocal. She argued that mass hysteria couldn't possibly cause the objective physical damage her body sustained. It's hard to believe that group panic could make a doctor as bones start to die. This led investigators to a second, more complex theory. Unconvinced by the mass hysteria conclusion, the Riverside Coroner's Office sent Gloria's tissue and blood samples to the Lawrence Livermore National Laboratory, one of the most advanced analytical labs in the country. What their scientists proposed was a shocking chemical chain reaction that started with a common, over-the-counter substance, dimethyl sulfoxide, or DMSO. DMSO is a powerful solvent, often sold as a deadreaser in hardware stores, but it also has a history as an alternative home remedy for pain. People who use it often report a garlic-like taste or smell, which matched some of the initial reports from the EOJ. The Livermore team theorized that Gloria, desperate for relief from the severe pain of her cancer, may have been rubbing DMSO on her skin. This could also explain the oily sheen staff had noticed. Normally, DMSO isn't dangerously toxic, but the scientists believed a perfect storm of circumstances transformed it into a deadly chemical. Here's the step-by-step theory they laid out. First, Gloria was possibly using large amounts of DMSO gel. Because her kidneys were failing, her body couldn't flush the chemical out, causing it to build up to a high concentration in her blood. Second, the oxygen paramedics gave her started to react with the DMSO, converting it into a new compound, dimethyl sulfone, or DMSO2. This substance is known to form crystals at room temperature, which could explain the manila-colored particles seen in her blood. The final, critical step is what likely happened next. The Livermore team proposed that either the electric shocks from the defibrillator or the sudden change in temperature and pressure when her blood was drawn into the syringe provided the energy for one last fatal conversion. They believed the dimethyl sulfone, DMSO2, was converted into dimethyl sulfate, or DMSO4. Dimethyl sulfate isn't just some strange chemical. It is a potent, highly toxic, and volatile poison, and exposure to its vapor can cause the exact symptoms the A staff experienced: fainting, paralysis, nausea, and shortness of breath. Crucially, it's also environmentally non-persistent, meaning it breaks down very quickly. This would explain why the hazmat teams found no trace of it. The chemical simply vanished before it could be detected. This DMSO theory was elegant. It explained the garlicky smell, the oily sheen, the crystals, the symptoms, and the lack of evidence. The Riverside Coroner's Office officially endorsed this as the most likely cause. However, the theory isn't perfect. There was no direct proof that Gloria was using DMSO. Her family strongly denied it. Furthermore, some chemists have argued that the proposed chemical reaction is difficult to replicate and unlikely to happen under the conditions inside a human body. So, while it remains the leading scientific explanation, it has never been definitively proven. Conclusion: more than 3 decades later, the case of Gloria Ramirez remains officially unsolved. On the other, you have the Livermore Lab's chilling hypothesis of a chemical chain reaction, perfect storm that turned a pain remedy into a weapon, a theory that relies on assumptions and lacks definite proof. Gloria's family continued to believe the hospital was somehow at fault, though no direct link to any error was ever found. To them, Gloria wasn't a toxic lady, but a victim whose tragic death was compounded by a bizarre mystery the hospital couldn't explain. The truth is likely buried somewhere between the complex realms of human psychology and volatile chemistry. Was it a case of minds turning on themselves in a moment of panic? Or did Gloria Ramirez's body, ravaged by disease and possibly saturated with an unorthodox remedy, truly become a source of toxic fumes?